Thanks everyone for taking the time out of your day to attend this training on the emergency mental health hold. My name is Haley Klingel. I am the provider training specialist for the 2765 team at BHA. So we'll go ahead and get started. On our agenda today, we're going to start with the purposes of 2765, updates from House Bill 22-1256, and some key terms. Then we will talk about the emergency mental health hold, including processes and M-forms. At the end of this presentation, we will cover information on subsequent emergency mental health holds, discharge instructions for individuals on the emergency mental health hold, and court-ordered screenings and evaluations. So first, we're going to start with the background and purposes of Colorado Revised Statute 2765. Section 65, Title 27 is the law for care and treatment of persons with mental health disorders. The statute defines and establishes how to provide services for those struggling with severe mental health disorders. The purposes of this legislation are to provide care and treatment that's administered with full respect for a person's dignity and personal integrity, to only deprive rights and full liberty when less restrictive options are unavailable, and only when a person's safety or the safety of others is endangered. And lastly, to provide privacy, dignity, and other rights to those who are undergoing care and treatment. House Bill 22-1256 went through some major updates in 2022. These updates include new patient rights for every involuntary mental health service, who can place transportation holds, several updates to the emergency mental health hold, new intervening professional definitions, outpatient certifications, new data reporting responsibilities, expanding BHA's responsibilities, and more. A majority of these updates came from House Bill 22-1256, went into effect starting January 1st of 2024. Next, we're going to review some of the updates that went into effect January 1st of 2024. One of the changes to the emergency mental health hold includes that certified peace officers, aka law enforcement, was separated from intervening professional definition, which we are going to review those definitions later. Intervening professionals and law enforcement will now have different pathways and language for placing emergency mental health holds. Additionally, law enforcement can ignore a warrant if the certified peace officer believes it's in the best interest of that client. Although it's important to note that this is subject to individual department's policy and local control. Another change is that original copies of the M-forms are no longer required. This means that agencies can use EHRs and are no longer required to use triplicate forms. Agencies are still welcome to continue using these triplicate forms, as for many agencies in the field, it is likely easiest to operationalize giving copies of all the forms to all appropriate parties this way. The difference is that it's no longer required by BHA. Additional updates include that this bill added criminal prosecution for any person who files a malicious or false petition for an evaluation. It also includes that emergency mental health hold ends 72 hours after the hold is placed, removing weekend and holiday exclusion. Statute was also updated to have new discharge instruction requirements, subsequent hold processes, added an evaluating professional definition, and clarifies only a professional person can place, transfer, or terminate a certification. Next, we'll review some key terms. The first is behavioral health crisis. This is a disruption in a person's behavioral health stability or functioning that requires a need for immediate assessment and treatment. A behavioral health crisis response team is a co-responder, mobile crisis response unit, or community response team that has at least one licensed or bachelor degree level behavioral health worker. Mental health disorders are disorders of the cognitive, volitional, or emotional processes that impair judgment, behavioral control, or capacity to recognize reality. It is important to note that intellectual or developmental disability is insufficient to either justify or exclude a finding of a mental health disorder. These next terms address definitions for mental health professionals. In statute, different mental health professionals and license types are separated by these definitions. The first is intervening professional. This can be defined as a professional person, a physician assistant, an advanced practice registered nurse, a nurse practitioner, a registered nurse with BHA identified mental health training, a licensed clinical social worker, a licensed marriage and family therapist, a licensed professional counselor, or a licensed addiction counselor. A professional person can be identified as somebody who is licensed to practice medicine in the state of Colorado. So this can be an MD, a DO, a PsyD, or a licensed psychologist. And throughout the presentation, we will talk about the differences between what an intervening professional can do and what a professional person can do. The next terms that we're going to review are the criteria for an emergency mental health hold. The first is danger to self. This is defined as when a person poses a substantial risk of physical harm to the person's self as manifested by evidence of recent threats of or attempts at suicide or serious bodily harm to the person's self. Danger to others can be defined as when a person poses a substantial risk of physical harm to another person or persons as manifested by evidence of recent homicidal or other violent behavior by the person in question, or by evidence that others are placed in reasonable fear of violent behavior and serious physical harm to them, as evidenced by a recent overt act, attempt, or threat to do serious physical harm by the person in question. Gravely disabled can be defined as a condition in which a person, as a result of their mental health disorder, is incapable of making informed decisions about or providing for the person's essential needs without significant supervision and assistance from other people. As a result of being incapable of making these informed decisions, a person who is gravely disabled is at risk of substantial bodily harm, dangerous worsening of any accompanying serious physical illness, significant psychiatric deterioration, or a mismanagement of the person's essential needs that could result in substantial bodily harm. It is important to note that this does not include developmental disabilities or dementia as the sole reason. This must be as a result of an underlying mental health disorder. And this is also not applicable when an individual has a caretaker managing their essential needs. Now we will move on to reviewing important information on the emergency mental health hold. In order to place this hold, the individual must meet statutory criteria and be unwilling to accept voluntary services. Individuals should always be offered voluntary services prior to the hold being placed, and the least restrictive setting suited to meet the individual's needs should always be used. An intervening professional typically provides the screening for this hold, and their criteria for placing the hold is if they reasonably believe the person appears to have a mental health disorder and as a result appears to be in imminent danger to self, others, or gravely disabled. If that criteria is met, then the individual is placed on the hold. The required paperwork for placing the hold is the application, which is the M1, and the patient rights, which is the M2. There are situations where voluntary services are not appropriate, even if the individual is willing to accept voluntary services. This is addressed in 2765-107-3A, which states, once the screening is completed, and if the person meets criteria, the intervening professional shall first pursue voluntary treatment and evaluation. If the person refuses, or the intervening professional has reasonable grounds to believe that person will not remain voluntarily, the intervening professional may place that person under an emergency mental health hold. It's important to note that reasonable grounds is not defined in statute. This will rely on the clinical judgment of that intervening professional and the results of the screening. If you are going to move forward with placing the hold, you must document your evidence of reasonable grounds on the M1 form. Next, we'll review the difference between a screening and an evaluation. These sometimes get used interchangeably in the field and in facilities, but when I'm referring to these processes throughout the training, they are different. A screening is the process completed to place an individual on an M1 for further evaluation and treatment. This happens prior to that individual being placed and makes a determination of whether that individual needs a comprehensive evaluation, treatment, a referral, or other appropriate services, and if so, if they'll accept this on a voluntary basis or not. Alternatively, an evaluation is the process following an individual being placed on an M1 and is completed at the 2765 designated facility or emergency medical services facility. The evaluation determines whether that individual continues to meet emergency mental health hold criteria, and if so, what further mental health care is recommended. There are certain components that are best practice in a screening. This is not required by statute, rather a guideline to use when creating a screening tool. This includes, but is not limited to, identifying information, a primary complaint, criteria for an emergency mental health hold. So if that individual appears to have a mental health disorder, and then suicide risk, imminent danger to self or others, or gravely disabled. It should also include current behavioral health symptoms, any medical concerns, and then a preliminary determination of level of care needed. Next, I want to review who can place an emergency mental health hold and who can end an emergency mental health hold. So an emergency mental health hold can be placed by intervening professionals and law enforcement. Although, as mentioned previously, law enforcement does have different criteria as they're no longer considered an intervening professional. An emergency mental health hold can only be ended by a professional person or an evaluating professional following an evaluation of that individual. We will review the evaluating professional definition in a few slides. So here's the one-page version of the M1 form, and there is also a two-page form available on our website. BHA has no preference on which form you use. It's all up to individual preference. A copy of this form must be given to the individual. We are not going to go through the step-by-step right now, but we do offer a live training on clinical documentation of this form that can be requested via our website. There are some important tips when it comes to documenting an M1. It's essential to document in as much detail as possible. Remember, you are restricting a person's rights and their free will. M1 applications are legal documents, and if an individual contests the restriction of their rights, this document will be used in court. So documenting properly protects you. Your documentation must demonstrate that that individual met statutory criteria to be held involuntarily. There is required documentation per statute that needs to be on an M1 form in order to be considered complete. These include the individual's name and information, the circumstances under which that person's condition was called to attention, and then sufficient facts to establish that that person, A, has a mental health disorder, and then is in imminent danger to self, imminent danger to others, or gravely disabled. This also must include observations from the intervening professional or reliable others. It also must include when the person was taken into custody, who brought the person's condition to the attention of the intervening professional, and then lastly, a signature of the intervening professional or law enforcement agent that is placing the hold. Moving on to what happens after a hold is placed. Once the hold is placed, an evaluating professional must complete the evaluation using the BHA standardized evaluation form, which is the M7.5, within 72 hours. This can be a professional person, an advanced practice registered nurse with training in psychiatric nursing, or a licensed physician assistant, LCSW, LPC, or LMFT who has at least 2 years of experience in behavioral safety and risk assessment working in a healthcare setting. The resolution of this hold does have to occur by that 72-hour mark. One thing I do want to note is that the finalized M7.5 form is available on BHA's website. Implementation of this form begins January 1st of 2025, and additional information and training is available for this form by request. Possible resolutions for an emergency mental health hold include release if that individual is no longer meeting criteria, short-term certification, voluntary treatment, or subsequent holds if the criteria for a subsequent emergency mental health hold is met. On this slide is a diagram that helps explain the roles and overlapping responsibilities of each category of definitions. All of the professionals on this slide can both end the transportation hold and initiate the emergency mental health hold. Both evaluating professionals and professional persons can complete the evaluation for an emergency mental health hold and end an emergency mental health hold or make a recommendation for certification. Only a professional person can initiate the certification process with the court and complete the required paperwork. Next, we'll review the M2.1, which is the voluntary advisement. This form is facility specific and can only be used by 2765 designated facilities. This does not apply to individuals being held in an emergency department. This is to be provided to individuals when they are electing to sign in voluntarily, and it must be provided to the individual both verbally and in written form. Moving on, we're going to briefly talk about patient rights. We do have other trainings available on patient rights, so please refer to those if you're wanting more details on patient rights. Any individual that's placed on the emergency mental health hold must have the M2 provided to them, both verbally, and the patient must receive a copy in addition to the written form that they sign. This form is an all ages form and should be given to both the minors and the adults. The form must be signed and dated by the individual that is providing the rights to the individual. There are responsibilities that facilities have in regards to patient rights. All rights have to be provided to the individual in written form and explained to them in a language or manner so they may understand. It's important to note that asking a patient to sign the M2 form does not mean they agree with their hold. It's an acknowledgement that they received their rights. The facility must also help the individual in exercising their rights. If a minor is unable or refuses to sign, attempts should always be made to provide the rights to parents or guardians if available. And then lastly, any restriction of rights must be entered into the individual's treatment record and made available upon request to the individual and their attorney. Rights can only be restricted by a licensed professional who's involved in the individual's care. So let's review the process of an emergency mental health hold. So this begins with the screening. During the screening, you determine if that individual meets the criteria for the hold and if there's any exemptions. You'll also want to determine if that individual will accept services voluntarily. If the criteria is met, you'll complete the required forms, which includes the M1 and the M2. Remember, it's best practice that patient rights are being provided by the intervening professional that's placing the hold. Lastly, the individual will be transported to an appropriate facility, and the evaluation will be completed by an evaluating professional to determine the treatment care needs. The next subject we're going to cover is subsequent holds. Subsequent holds are specific to emergency departments and can only be used by an emergency department if additional criteria has been met. Subsequent holds can only be used if placement has not been found for the individual during their initial emergency mental health hold, that individual continues to meet emergency mental health hold criteria, and the individual will not remain voluntarily in treatment or will not seek treatment voluntarily. If criteria is met and a subsequent hold is placed, the M1.1 form must be completed by the evaluating professional and submitted to the court. Per statute, the subsequent emergency mental health hold must be sent to the court, BHA's care coordination, and the person's layperson. Once the court is notified after the M1.1 is sent, they shall immediately appoint an attorney to the individual. One additional thing that's important to note is that BHA is providing care coordination services for those on subsequent holds. To find additional information on this, you can either visit our website or contact Callie Lickness via the email on this slide, who is our care coordination training specialist. This next slide shows the M1.1 form. This form serves as notification for the court and must be completed and sent to the court anytime a subsequent hold is placed. Lastly, I want to go over some frequently asked questions and best practices when it comes to subsequent holds. The first is, when should the M1.1 be written? This should be completed when that subsequent hold is placed, in addition to the M1 being completed for the subsequent hold. The second is, can I write this before the initial M1 expires? This can be written prior to the initial M1 expiring, but should be close to the time that it's expiring. In addition, it needs to indicate the original hold's end time and the new hold's start time. The last question is who can use these? Emergency medical services facilities can use a subsequent hold. This means any general hospital with an emergency department or a freestanding emergency department. One thing to note is that subsequent hold should not be used when an individual has an unresolved medical need. Medical needs should always be treated as primary. Next, we're going to move on to talking about discharging an emergency mental health hold. Only the person in charge of the evaluation may terminate the emergency mental health hold. Evaluations must be completed by an evaluating professional. Discharge requirements were updated per statute and added to rule. The facility shall provide each person detained for an emergency mental health hold with discharge instructions. This must be completed for every person, regardless of their discharge status before they're released. The discharge instructions must include a summary of why that person was detained and why they no longer meet criteria for holder certification, any changed, new, or discontinued medication, including a clinically appropriate supply, safety plan, which must also be provided to the client and their layperson if they have one, notification to the individual's primary care provider, and then referral to appropriate services. Any referrals must be documented in the medical record as well. It also must include the crisis hotline information, psychiatric advance directive if that individual has one, a list of any screening, diagnostic tests, labs, or vitals, a summary of the treatment that was provided, how to contact the discharging facility if needed, and the statewide care coordination infrastructure when implemented. Outside of paperwork, there are additional discharge requirements. These include follow-up calls that must be completed within 48 hours of discharge. If the individual is enrolled in Medicaid, you must notify the person's relevant RAE of the discharge and need for ongoing follow-up. Additionally, now per statute, if your facility is contracted with the safety net provider, you shall work with the safety net provider to meet the follow-up requirements. Additional updates to discharge requirements include the facility shall document whether that person accepted the discharge instructions and shall provide the discharge instructions to the person's parent or legal guardian and to the person's layperson if applicable. If there is a refusal, this must be documented in their record. And lastly, as of July 1st of 2024, upon discharge, the facility shall discuss with the person's parent or legal guardian, and the person's layperson of the statewide care coordination infrastructure. The last subject we're going to cover today is the petition for the emergency mental health hold, which is the M4 petition. Any person can petition the court and request a court-ordered evaluation of an individual. This can be a good option for concerned family and/or friends. This petition must be filed with the county court in which the individual resides or is currently present in. The court has a few options of what they can choose in response to a petition. If that petition does not satisfy reasonable grounds of a mental health disorder, the court can still order a screening of the individual via an M3 form. Here's what the M4 petition looks like. This must be completed in its entirety with as much detail available to the petitioner to show that that individual has a mental health disorder, and as a result, the individual is in imminent danger to self, others, or gravely disabled. This next form is the order for emergency screening, which is the M3. This is used when the petition does not show adequate evidence that that individual has a mental health disorder. The court can then instead order an initial screening of the individual to be conducted. The evaluating professional then must complete the M6, which is the screening report, and submit this to the court. The next form is the notice of screening, which is the M5. This follows when a court orders an M3 screening and notifies the individual of that screening. This must be provided to the individual listed in the M3 order and completed by the designated facility that's listed in the court order. The screening report is the M6 form, and this must be provided to the court regardless of the screening outcome. A copy of this form has to be provided to the individual's attorney, or their representative post-screening. As a result of this screening, the M1 process can be initiated if the individual is meeting the criteria for the hold. The professional completing the screening can also request court-ordered evaluation for further intervention. The next form is the order for evaluation and treatment, which is the M7. Alternatively to the M3, this can be ordered by the court if the original petition satisfies probable cause of a mental health disorder and that individual has refused voluntary evaluation. This will order the individual to a facility for evaluation and can be accompanied by a court order for secure transport, which is the M18. The last form related to this process is the notice of disposition, which is the M3.1. This is only to be used if an M7 is ordered and is submitted to the courts following an M7 order to notify them. This form is only to be used if an individual is not certified. This form should be used if an individual has either been discharged or accepted services voluntarily. And here is a flowchart of the information we just went through. I do want to note that this is a public-facing document and can be found on our website under supportive forms. And this last slide is a visual tool that follows the involuntary mental health process. This tool is also available on our website and is also a public-facing document. So you're more than welcome to print it off or use as a resource however you like. This document includes all of the M forms that must be completed for each process and who can complete those forms. It starts with the emergency mental health hold, which is the process we just reviewed, and then moves on to the certification process. That's the end of the presentation that I have today, and thank you for participating. If you'd like to take a look at our other recorded trainings or resources, you can access them at the link on this slide. Additionally, if you'd like to request a training, this can be done via the QR code or through the training request tab on our website. As always, reach out with any questions you have, and thank you again for watching this training.